Hello everyone, this is Gautam Thelu. My project is about spread of human immunodeficiency virus with perinatal infection. Human immunodeficiency virus is not fatal. It is now regarded as a manageable condition. Steve Longnecker was already developed a simulation model using NetLogo application. Steve's model was mainly developed based on transmission of HIV via sexual activities. The aim of this study is to add transmission of HIV through perinatal, where the virus transmits from mother to child during birth or breastfeeding. Assumptions were made on the sexual behavior and childbirth for simplification of code. More than the interrelationship between variables, the effect of perinatal infection of HIV were focused. Model was tested for ability to simulate actual conditions using various states of variables. Steve's simulation model on HIV transmission can be found on the NetLogo model library. In this study, I had included perinatal transmission. Data were retrieved from the United States Center for Disease Control and Prevention and World Bank database. All data were manipulated to meet our requirement. For example, the death rate is usually calculated per thousand in population, but here the model needs the percentage. Perinatal infection tendency and average coupling tendency variables are used. Perinatal infection tendency is the tendency where a new birth is infected. The time in which a couple engages in sexual activities can probably decide the birth rate, but in this study it was assumed as constant. The perinatally infected patients were colored differently to identify them. The United States rate of death and birth were used. To simplify this model, we have taken the birth rate as 1.8%, the death rate was set to 0.9%. Both rates are considered as constant. Sliders value for perinatal infection tendency and average coupling tendency ranges from 0 to 10, where value 10 indicates 100% of births are HIV infected, while 0 indicates 0% of births are HIV infected. If you see results, when perinatal tendency variable is placed at 5, we can see no single perinatal infection even after 265 weeks. In this study, population in yellow color are identified as perinatally infected people. We can see few perinatal infections after 500 weeks. When perinatal tendency variable is changed to 10, increment of perinatal infection is observed. Perinatal infection is not significant in number, but more sensitive and important for the management of public health. The aim of the society is not to reduce perinatal HIV infection, but to eliminate it. Therefore, even small numbers will give significant impact. That's all about my project. Thank you.